Hello, I'm Russell Carlson, Commissioner of the Georgia Department of Community Health. I'll start by giving a heartfelt salute to you, our retired and almost retired teachers, public school and state employees, and the dedicated service you provided during your tenure. In so many ways, you made a tremendous impact, and the entire state of Georgia owes you a debt of gratitude. A major part of my role as Commissioner is ensuring that you have the right healthcare resources and information in place to support you in retirement. That's why I'd like to welcome you to the 2024 State Health Benefit Plan Medicare Advantage University. This informational session will help guide you through healthcare benefits and resources available to you through Anthem Blue Cross and Blue Shield and United Healthcare. Please take full advantage of this session and do not hesitate to reach out to State Health Benefit Plan representatives with questions or concerns regarding your coverage. I'm committed to a healthy Georgia, and I'm committed to making sure your care needs are met. Again, thank you for your service to the state of Georgia. I'll now turn our presentation over to Louis Amos, Executive Director of the State Health Benefit Plan.
Greetings. I'm Louis Amos, Executive Director of the State Health Benefit Plan. The State Health Benefit Plan, along with our third-party administrators, Anthem and United Healthcare, welcome you to today's presentation and are happy to share valuable information with you about your 2024 Medicare Advantage plan options. The agenda provides a look at the topics we will cover today. We will cover the ABCs of Medicare, who is the SHBP Medicare Advantage University for, maintaining eligibility and qualifying events, the 2024 SHBP MA Plan benefits and programs, additional resources, important tips and reminders for retirees, contact information. I'm now going to turn the presentation over to my team, who will go into details about the benefits and services provided through our Medicare Advantage plan options. Again, welcome to SHBP's Medicare Advantage University.
Let's first start off with learning a little bit about Medicare. Original Medicare is the United States health insurance program for people age 65 or older who are retired and those under 65 who are receiving Social Security disability benefits. Original Medicare does not include everything, but includes Part A, which provides some hospital coverage, and Part B, which provides some doctor and outpatient coverage. Most people are automatically enrolled in Part A, but if you are not entitled to Part A, please contact the State Health Benefit Plan at 800-610-1863. You must pay Social Security a separate monthly premium for Medicare Part B. You must continue to pay your Medicare Part B premiums to remain in the SHBP Medicare Advantage Plan. A Medicare Advantage plan is sometimes referred to as a Part C plan and covers all Medicare Part A, Medicare Part B, and some additional benefits such as hearing aids and vision benefits. Your SHBP Medicare Advantage Plan also includes Medicare Part D, prescription drugs. SHBP's Medicare Advantage University meetings are intended to help you get the most out of the SHBP Medicare Advantage Plan options and may be helpful for the following members. Medicare Advantage retirees. Retirees who are currently enrolled in an SHBP Medicare Advantage Plan option and want to understand more about how their plan works. Early retirees. Retirees who are turning age 65 and want to understand how to prepare for Medicare eligibility. Active members who are turning 65. Members who are actively working and close to turning age 65 and may or may not be retiring. Let's take a closer look at option 2 from the previous slide regarding the steps SHBP retirees who are not actively working and getting ready to turn age 65 should take. As a courtesy, SHBP will contact you via mail at the address SHBP has on file at 4 months and 2 months before your 65th birthday and at age 65, requesting you to enroll in Medicare Part B and provide proof to SHBP to be eligible for enrollment in one of the SHBP Medicare Advantage Plan options. To enroll in Medicare Part B, you should contact the Social Security Administration at least 90 days prior to your 65th birth month. For example, the month you turn age 65. Once you enroll in Medicare Part B, you will be mailed a red, white, and blue Medicare Health Insurance card. You must provide the Medicare Part B information to SHBP 1 month prior to your 65th birthday and have a physical address on file with SHBP. Visit myshbpga.adp.com or call SHBP Member Services at 800-610-1863 to choose which Medicare Advantage Plan option you would like to enroll in. Please note, you must be enrolled in Medicare Part B to enroll in an SHBP Medicare Advantage plan. Let's take a closer look at option 3 from the previous slide regarding the steps SHBP active employees who are not retired and getting ready to turn age 65 should take. As a courtesy, SHBP will contact you via mail at the address SHBP has on file at 4 months and 2 months before your 65th birthday and at age 65, requesting you to enroll in Medicare Part B and provide proof to SHBP. No additional notices will be sent before retirement. If you continue to work past age 65, you must provide SHBP your Medicare Part B information at least 1 month prior to your retirement date. You cannot enroll in an SHBP Medicare Advantage Plan option until you retire from an SHBP employing entity. However, you may provide you or your covered dependents' Medicare Part B information to SHBP at any time. Please read all of the plan documents carefully, including the SHBP eligibility and enrollment provisions document and the evidence of coverage or EOC document and other information posted on SHBP's website, shbp.georgia.gov, and take the required actions. It is important to keep your address current with SHBP. Please be sure to update any changes to your address as needed. You can make corrections anytime during the year either online at myshbpga.adp.com or by calling SHBP Member Services at 800-610-1863. Pay all required premiums to SHBP by the due date and be sure to check with your state retirement system monthly to ensure all required SHBP premiums are being accurately deducted and submitted to SHBP. Continue to pay your Medicare Part B premium to the Social Security Administration if you are enrolled in an SHBP Medicare Advantage MA plan option. Do not enroll in a third-party, non-SHBP Medicare Advantage plan Medicare Part D plan, or Medicare supplement, or you will lose eligibility for SHBP Medicare Advantage coverage and be automatically enrolled in an unsubsidized active commercial plan option. Failure to comply with any of these steps listed above will result in your SHBP premium being unsubsidized, and you will be responsible for the entire costs of coverage, which is substantially higher than your current premium. Haven't received your 2024 retiree option change period materials? They may have been returned to SHBP due to an insufficient address. SHBP provides 2 ways for retirees to update their contact information with SHBP. 1. SHBP enrollment portal at myshbpga.adp.com, and 2. SHBP member services at 800-610-1863. To avoid missing important mail from SHBP, keep your contact information up to date in the SHBP enrollment portal. The next slide explains 2 ways retirees can update their contact information. SHBP enrollment portal is available 24 hours a day. myshbpga.adp.com is available 24 hours a day, 7 days a week. Retirees can access the portal at home, on vacation, and anywhere convenient with a computer to update their contact information. SHBP member services hours are Monday through Friday, 8:30 a.m. to 5 o'clock p.m. Eastern Time. Retirees can call SHBP member services at 800-610-1863 to update their contact information. If there are extensive wait times, you will be prompted to take advantage of the following features. Virtual holds allow you to virtually hold your place in the queue, then receive a call back when it's your turn. Scheduled callbacks allow you to schedule a callback at a time that is convenient for you. If you have any questions, in addition to contacting SHBP member services at 800-610-1863 to speak with a representative, you may also email SHBP member services at shbpservicecenter@adp.com. The SHBP member services email system is available year-round to retirees who have registered in the SHBP enrollment portal, and emails are accepted 24 hours a day, 7 days a week. Responses are provided within 1 to 2 business days. Retirees cannot update their addresses via email. ROCP elections, life events, demographic updates. For example, your name, address, or Social Security number updates cannot be made via email. Response emails will only be provided to the email address on file for the retiree, or the email address specified by the retiree for communications. If a retiree has provided another email address for communications other than the email address in the SHBP enrollment portal, no response will be sent to the email address in the SHBP enrollment portal. Please be sure to keep your preferred email address current in the SHBP enrollment portal to avoid missing out on important communications. If you have designated a personal representative to act on your behalf, they should provide legal documentation, for example, a general or financial power of attorney or court order establishing their authority to act on your behalf. The form can be completed along with uploading the legal documentation on the SHBP website at shbp.georgia.gov. Please note, an advance directive for healthcare or medical power of attorney is not sufficient. At the time of retirement, only the dependents currently on your plan will have coverage. Once you retire, you cannot add your spouse or dependents except for certain qualifying events. During Retiree Option Change Period, ROCP, you cannot add your spouse or dependents. However, if you do experience a qualifying event, you must declare the qualifying event by notifying SHBP Member Services within 31 days of your event. For example, if you got married on August 1st, you must declare the marriage event by notifying SHBP Member Services within 31 days or no later than September 1st. The following life changes are considered qualifying events for SHBP retirees: marriage, children, gaining coverage, losing coverage. For more details on what is considered a qualifying event for retirees, please visit the retiree section of the SHBP website. Now, let's take a closer look at some of the more common benefits of the standard and premium plans. As mentioned before, the plan designs between Anthem and United Healthcare have the same core benefits. Both companies offer the standard and premium plans. The grid shows some of the more common benefits on the plan and notates some differences between the standard and premium plan. Neither plan has a deductible, but some copays are slightly lower on the premium plan than they are on the standard plan. The out-of-pocket maximum for the standard plan is $3,500 per year, and on the premium plan is $2,500. This amount does not include prescription drugs. Both the standard and premium plans cover preventive care at 100%. Let's also take a look at your prescription drug coverage with the standard and premium plans. The table shows what you will pay for a 1-month supply at a retail pharmacy. Costs for a 100-day supply via retail and mail order are available in your plan documents and retiree decision guide. While both Anthem and United Healthcare each have their own unique prescription drug lists, they both offer select generic drugs at a $0 copay. A list of these drugs can be found on both of the company websites. Now, let's take a few moments to learn about the different programs and benefits that are included with the SHBP Medicare Advantage plan options and go beyond what original Medicare covers. Anthem and United Healthcare offer SHBP Medicare Advantage retirees exclusive programs and services that go beyond what original Medicare covers, including the following. House calls are designated to support and complement your regular doctor's care through an in-home wellness visit with a licensed healthcare practitioner. Virtual visits allow you to video chat with a doctor or behavioral health specialist from your phone, tablet, or computer from the comfort of your own home, any time of day. 24/7 telephonic nurse support lets you speak with registered nurses who are available anytime, day or night, to answer your health-related questions. In addition to Medicare-covered chiropractic, your plan covers up to 20 routine chiropractic services subject to the standard or premium plan specialist copay. Meal delivery programs are available to you when you need it the most, such as after an inpatient or skilled nursing facility stay. access to discounts on hearing aids, as well as a $1,000 allowance every 4 years. Chronic and complex needs programs who help retirees who are living with a chronic disease like diabetes or heart disease. With the vision benefit, retirees not only can complete one routine eye exam every 12 months, but receive up to $125 combined allowance for eyewear and contact lenses every 12 months with United Healthcare and every 24 months with Anthem. Both Anthem and United Healthcare offer SHBP retirees access to Silver Sneakers, which gives you a free membership to participating gyms and fitness centers. In addition to the $0 cost monthly membership fee and group exercise classes at thousands of participating fitness centers, with Silver Sneakers, you're free to move in the ways that work for you. You have access to virtual resources and a support network through Silver Sneakers Live, Silver Sneakers On Demand, and the Silver Sneakers Go fitness app. You have the ability to enroll in multiple locations at any time, and you can also utilize Silver Sneakers community classes to get active outside of traditional gyms. We would like to highlight for you other programs that United Healthcare has created for you as a retiree that aim to keep you in control of your health and fitness. As a United Healthcare retiree, you have access to Let's Move, Rally Coach programs, and Renew. Let's Move is a program designed to truly engage you in wellness activities, to get you moving. Activities include virtual fitness classes, cooking demonstrations, financial wellness webinars, meditation and mindfulness events, caregiver resources, and more. United Healthcare offers interactive events throughout the calendar year that may be live, virtual, or on demand. With Rally Coach programs, you will have access to unique programs designed to promote health and wellness, including weight loss, diabetes prevention, wellness coaching, and smoking cessation. Renew by United Healthcare is a health and wellness experience for inspiring lifestyle tips, learning activities, videos, recipes, interactive health tools, and more, all designed to help you live your best life. Plus, you can earn rewards for preventive screenings such as your annual wellness visit. All three of these programs can be accessed after you log in as a member on the United Healthcare website, retiree.uhc.com/SHBP. With next month being Mental Health Awareness Month, we wanted to share some features of both the Anthem and United Healthcare's plan, which supports mental and behavioral well-being. New in 2024 is coverage for marriage and family counseling. In addition to inpatient and outpatient visits, you have access to virtual behavioral health visits, where you can connect with a behavioral health provider anytime, day or night. You can conduct one of these visits by your computer, tablet, or smartphone, and the behavioral health clinicians can address multiple behavioral health needs, including depression, stress, anxiety, trauma, or loss. Self-care apps for mindfulness and well-being are available through United Healthcare's Self-Care by Able2 and Anthem's Sydney app, as well as other online tools and resources. You have access to telephonic nurse support. When you call the number located on the back of your ID card, you will be connected with a nurse 24 hours a day, 7 days a week. Our nurses will work with you to assure that they connect you to the care that you need. In addition, both plans offer behavioral health case management support. Behavioral health case managers complete a comprehensive assessment and evaluation of your needs to provide available resources and benefits. The case manager works with you to address barriers and facilitates referrals and coordination with providers to address your needs. Both the Anthem and United Healthcare Medicare Advantage plan options offer coverage nationally throughout the United States and U.S. territories. With the Medicare Advantage plan options, you have the flexibility to see providers that are both inside and outside the plan's network with the same cost share. You can see any provider that accepts Medicare and the plan. If you travel outside of the country, emergency services are covered. You will need to pay up front for the services and submit a copy of the bill to the address on the back of your member ID card for reimbursement. If you would like to find out more about SHBP retirement eligibility and requirements, take advantage of REST. The Retiree Educational Sessions and Training, also known as REST, was created by SHBP to have an educational program specifically for our retirees and those pre-retirees who continue coverage with SHBP after transitioning from employment with an SHBP employing entity. Visit the REST section of the SHBP website at shbp.georgia.gov/REST. To find out more information about plan options, rates, direct pay, turning age 65, eligibility, notifications, and processes for SHBP Medicare Advantage plans, please visit the Retiree section of the SHBP website at shbp.georgia.gov/members/retirees. Be sure to check your email carefully to ensure mailings are from official SHBP sources. If you are unsure, please contact SHBP Member Services. Once you enroll in an MA plan with United Healthcare or Anthem, you will receive a new insurance card to use when receiving health services. Store your red, white, and blue Medicare health insurance card you received when enrolling in Part B securely in a safe place. If you do not make a Medicare Advantage plan selection after providing SHBP with your Medicare Part B information, you will be defaulted to the MA Standard Plan with United Healthcare. Continue to pay the Medicare Part B premium to the Social Security Administration if you are enrolled in an SHBP Medicare Advantage MA plan option, and continue to pay your monthly SHBP coverage premiums to SHBP. If you discontinue your SHBP coverage for any reason, you will not be able to re-enroll unless you return to work in a benefits-eligible position that offers SHBP benefits. The information provided on this slide is extremely important. It explains how to provide Medicare Part B information to SHBP. You should contact the Social Security Administration at least 90 days prior to your retiring and/or turning age 65. You must provide your Medicare Part B information directly to SHBP at least 1 month before your 65th birthday, if you are retired, or at least 1 month prior to your retirement date, if you continue working past age 65. Contact SHBP Member Services at SHBP Service Center at adp.com. Call 800-610-1863 or visit the SHBP enrollment portal and take the following steps. Log in to the SHBP enrollment portal. Select My Information. Then select Medicare Management. Select the pencil next to your name or your dependent's name to enter Medicare Part B information. Click Submit to save your Medicare Part B information. As a reminder, if you are currently enrolled in a commercial, active non-MA plan option with Anthem or United Healthcare, remember to redeem any points before transferring into a Medicare Advantage plan option. Points are not automatically redeemed and transferred for Medicare Advantage members. When you redeem your points for well-being incentive credits prior to moving to a Medicare Advantage plan option and have a balance of 100 or more credits after the claim's run-out period, which is 6 months, the credits will remain with the active non-Medicare Advantage plan if you have a spouse and or dependent who is still on that plan. If there are any credits remaining once the last active member moves to Medicare Advantage, the credits will follow that member, or the credits will move over to your Medicare Advantage plan option in a retiree reimbursement account if there are no members left on the active non-Medicare Advantage plan. Once you move over to a Medicare Advantage plan option, you are no longer eligible to earn points with ShareCare. We hope you have found this presentation to be beneficial. For your convenience, a copy of this presentation can be found at shbp.georgia.gov. If you have any questions or need additional information regarding eligibility, please contact SHBP Member Services at 800-610-1863, Monday through Friday from 8:30 a.m. to 5 o'clock p.m. Eastern Time, or visit the enrollment portal at myshbpga.adp.com. If you have any questions about the Anthem Blue Cross and Blue Shield Medicare Advantage plans, please give Anthem Blue Cross and Blue Shield a call at 855-322-7062 from 8 o'clock a.m. to 8 o'clock p.m. Eastern Time, Monday through Friday. If you have any questions about the United Healthcare Medicare Advantage plans, please give United Healthcare a call at 877-246-4190 from 8 o'clock a.m. to 8 o'clock p.m. local time, Monday through Friday. This concludes our presentation for the 2024 SHBP Medicare Advantage University. Thank you for attending, and we look forward to continuing to serve you.